Dear colleagues, I'm glad to introduce the use of the buccal pedicle flap for peri-implant soft tissue boosting. I'm Giorgio Tabanella, and American board certified in both periodontics and implant dentistry, and my field of expertise is the treatment of failures in dental medicine. This is a classic clinical situation where we're dealing with chronic periapical lesion and external root resorption on both central incisor associated with the fistula. The fistula is creating also a buccal fenestration, but it's quite visible also the external root resorption on the sagittal cuts on the right hand side towards the palatal aspect. We're dealing with a patient with a high risk profile. The patient is a smoker. We have a very high patient expectations. We're dealing with a high smile line and a very thin phenotype. First, we need to eradicate periodontal disease. Then we're going to perform orthodontic realignment, extraction of both central incisor, immediate implant placement, and then we're going to boost the peri-implant mucosa by using the buccal pedicle flap. This is at the time of immediate extraction placement and simultaneous guided body generation to correct the fenestration, to repair the fenestration, also to create a buccal bone balcony. At the time of uncovery, after 4 months, I'm going to perform the buccal pedicle flap. And also, I'm going to use simultaneously the Fibro-Gide. The Fibro-Gide will be trimmed towards its border so that the border itself will not approach the vertical incision of the buccal pedicle flap. This is a tricky part of all the procedures. Generally, I don't reduce the thickness of the Fibro-Gide except for, again, just the border. This is how the tissue looks like immediately after the pedicle is translated towards the buccal aspect, which is quite useful also to reposition the mucogingival junction and to increase the depth of the vestibule without performing any kind of advanced procedures. We need to create the wrinkles during the buccal pedicle flap, and then we're going to deliver a provisional which is mesially cantilevered. We're going to extract number 11 and of course implant being placed. So now we're performing a second buccal pedicle flap on area number 11 with the use also of Fibro-Gide, and again I'm going to use monofilament sutures. This is the results after both buccal pedicle flap, 8 weeks after, allowing the tissue to mature properly. We do have, of course, a good thickness of the peri-implant mucosa, a good bend of keratinized mucosa itself, and of course, finally, a good biomimetic at the level of both central incisor after this long period of treatment. Well, so which are the key points here? First of all, we need to insert the implant in the prosthetic-driven direction. Then, of course, we need to have a good thickness of the buccal bone balcony. And then, of course, we need to manage properly the soft tissue, which will create a perfect sealing around the neck of our implant.